Hello and welcome to the Stroger Hospital and Cook County Health and Hospital Systems Training Module number 21, Environmental Cleaning and Disinfection for the Clinical Support and Outpatient Service Areas of Stroger Hospital. We are pleased that you have once again made the commitment to take the time to participate in this important skills training module. So let's get started.
As an experienced member of Stroger Hospital's Environmental Services team, you should be well aware of the importance of environmental cleaning and disinfection of all rooms and areas of Stroger Hospital. As EVS workers, we perform a vital and important role at Stroger. Our mission is to remove bacterial contamination from surfaces and equipment where patients receive care in order to prevent the transmission of microorganisms from patient to patient or from patient to staff. To succeed in this important mission, each of us, as environmental services workers, must possess the skills to perform cleaning and disinfection effectively and efficiently.
A summary and overview of the subject matter we will be covering in this training module include the following. 1. Interacting with patients and medical staff using the AIDET plus P method. 2. Emptying waste receptacles. 3. High and low dusting. 4. Sanitizing all horizontal surfaces and high hand touch areas. 5. Spot cleaning vertical surfaces. 6. Cleaning restrooms that are adjacent to or part of the clinical support and outpatient service areas. 7. Dust mopping floors. 8. Final inspection of your work before damp mopping. 9. Damp mopping as your final step when you exit the area. 10. Cleaning offices, desks, and workstations that may be inside of or adjacent to clinical support areas. 11. Cleaning kitchenettes and break rooms located in clinical support areas. 12. Cleaning physical therapy equipment. 13. Cleaning the radiology and other medical imaging departments and special precautions that must be taken in the MRI area. 14. Cleaning the cath lab. 15. Cleaning medical exam rooms. And finally, 16. Cleaning outpatient operating rooms.
We will now start by reviewing the Stroger Hospital process, AIDET plus P, and we will consider how it guides us in our polite and professional interaction with patients, guests, and medical staff who might be present in the clinical support or outpatient areas. First thing is that if you approach the area or room and the door is closed, always knock first and wait to hear a reply before entering. If someone is inside of the room and they ask for privacy, do not open the door and do not enter. Instead, come back and clean the room or area later. Once inside of the room or area you are to clean, if patients, guests, or medical staff are present, use the interpersonal skills you have been taught in AIDET plus P, remembering what each letter in this acronym stands for.
A stands for acknowledge the patients, staff, and guests. Speak to them directly, making eye contact. Have a pleasant tone of voice. If you notice a name tag, refer to them by their name using the formal Mr., Mrs., or Miss along with the last name to show respect. If you know that the person you are interacting with is a doctor, refer to them as such using the title doctor with their last name. I means introduce yourself by name first and last. D stands for duration, and it means let the patient, staff, and guests know that you will be working in the room for about 15 to 20 minutes, or longer if the room is large and your duties will require more time. If the patient, guest, or staff asks you not to clean and to come back another time, respect that request and make the necessary arrangements in your work schedule to do so. E is for explain, by letting the people present know that you are from the Environmental Services Department of Stroger Hospital and you are there to clean and disinfect the area. T stands for thank you. Be sure to say please and thank you often, and especially be certain to say thank you when you are finishing your work and leaving the room or area. P is for promise. Your promise to the patient, guest, or staff is to take care of any requests they might have that you can take care of yourself, provided that you are authorized to take care of it yourself. Examples of such requests would be cleaning a surface or a spill, providing linens, moving a light piece of furniture, or turning on or off a light. Requests that you cannot take care of or that you are not authorized to take care of, you need to promise that you will report the request to someone who can. Examples of requests you cannot and should not take care of yourself include giving medicine to a patient, giving food to a patient, moving a patient, or requests for repairs to the clinical support room. For these types of requests, you can promise that you will report the request to your supervisor on behalf of the person who has made the request to you.
Always remember, as a member of the Stroger Environmental Services team, you are an ambassador for the hospital. You have only one chance to make a great impression. Always use it to do your best.
Determine what PPE to wear. To begin your cleaning in a clinical support area, you will start by emptying the waste receptacles. But before beginning this work, perform hand hygiene and put on appropriate PPE, making sure to put on the correct PPE for the clinical support areas. Gloves are required for all cleaning work that you perform in Stroger Hospital. Note, however, that the following additional special PPE requirements will be necessary for each of the following clinical support areas. The cath labs will require that you wear a hair cover and gloves. In special procedure rooms, you will also be required to wear a hair cover and gloves. In MRI areas, you will need to wear the hair cover and gloves. Also, please note that you will need to wear radiation precaution PPE. And finally, in case rooms, you will be required to wear a hair cover and gloves.
Emptying waste receptacles. Now, with the appropriate PPE in place, next inspect the area before pulling out trash. This is to help you plan your work by determining which portions of the room need special attention. Pre-inspection also allows you to gather any loose trash and place it in the wastebasket before waste collection. Also, please note the following. In specifically designed special procedure rooms, all washroom trash must first be checked by the Stroger medical staff technician that is on duty before an EVS employee can dispose of the trash. If you are cleaning one of these special procedure rooms, be sure that you take this important step. If there is a large amount of waste in the trash receptacle, do not use your hands or feet to compress trash. You should know this important safe work procedure from previous Stroger training modules. This is for the prevention of injury from loose sharps that might be improperly disposed of. Gather trash from the waste receptacles by pulling up on the upper edges of the liner. Lift the waste liner slowly out of the receptacle and make sure that you keep it away from your body. Do not let the full trash liner bump up against any part of your body, such as your legs, your arms, or your waist. Instead, hold it away and carry it to the designated container. Remember to keep the red bag medical waste separated from standard waste. Also, check Sharps containers and replace full ones with new empty containers as needed, following all procedures for safe handling. Lastly, wipe the interior and exterior of the waste receptacles and then reline with a new liner.
After you have completed emptying the waste baskets, your next step is to perform high and low dusting of horizontal and vertical surfaces. Start with the high-level surfaces and work your way down. Make sure to dust surfaces that are shoulder height or higher, utilizing an extension tool when necessary. Be sure to dust vents and the walls around vent openings. Dust ledges, furniture, fixtures, and any other surfaces that need dusting as you work your way down. Remember that all horizontal surfaces like window ledges, shelves, cabinet tops, and wall chair guards collect dust. If there is any technical, medical, or lab equipment, such as CAT scanners, microscopes, X-ray machines, dialysis machines, or other electronic or precision diagnostic equipment, do not touch and do not dust and do not clean in any way.
Sanitizing horizontal and vertical surfaces. Your next step should be sanitizing all horizontal and vertical surfaces and high hand touch areas. For this task, use neutral disinfectant cleaner. Make sure to give the adequate 10 minutes of wet dwell time on each surface you clean. This assures the cleaning of microorganisms to help in Stroger Hospital's efforts at infection control. You must clean all hard surfaces that are frequently touched by human hands, such as the doorknobs, light switches, and side tables. Look around the room and you will see the high hand touch surfaces. Identify them and then focus your best cleaning and disinfection efforts there. Next, clean all furniture and equipment in the area, along with vertical and horizontal ledges. When spot cleaning horizontal and vertical surfaces, use neutral disinfectant cleaner and look for areas that are soiled or need cleaning. Don't forget to clean the inside and outside of waste receptacles after you have pulled the trash, while also checking the walls around the waste receptacle to spot clean as necessary. Spot clean wall fixtures and light switches, again with an emphasis on cleaning the high hand touch areas. Always remember that neutral disinfectant cleaner needs time in order to work effectively, so always allow for the necessary 10-minute wet dwell time for the cleaner to sit on the surface before you wipe it off.
Cleaning restrooms in or adjacent to clinical support and outpatient areas. The clinical support and outpatient areas of Stroger Hospital may have one or more restrooms inside of the area or adjacent to the area. These restrooms may vary in size from a small private bathroom with only one sink and one toilet up to a large bathroom locker room with multiple sinks, urinals, toilets, and a large shower area. These larger bathroom locker rooms are commonly found in the physical therapy areas. Whatever type of bathroom is located in the clinical support or outpatient area, you must be ready to provide a complete cleaning and disinfection of the entire bathroom or locker room facility. Prepare to clean the restroom by placing the wet floor sign next to the restroom door. Next, high dust all horizontal surfaces in the restroom. For disinfection cleaning of surfaces and fixtures in the restroom, make sure you are using neutral disinfectant cleaner and orange microfiber wipers. Remember, orange wipers are for bathroom cleaning only. Blue wipers are for room cleaning only in all other areas outside of the bathroom. On all bathroom surfaces, it is very important to apply the neutral disinfectant cleaner and allow the full 10-minute wet dwell time for the disinfectant to fully kill germs, viruses, and other microorganisms. Make sure to clean mirrors and dry with a paper towel to prevent streaks. Clean sinks and the surrounding areas such as the counters, underside of the sink bowls, and piping under the sinks. Make sure to spot clean all splash marks on the wall that may be adjacent to the sinks, the toilets, and the showers. If showers are present, clean the showers, starting at the top and working your way down, and being sure to scour the shower basin floors. If shower curtains are present, clean them, being sure to remove any mold or mildew. If any shower curtains cannot be cleaned or are torn and tattered, report this to the Stroger Building and Grounds Department for replacement. Next, start disinfecting the toilets by first applying bowl cleaner into the bowl of the toilet bowls and allowing it to sit for 10 minutes or more. Apply neutral disinfectant cleaner to the rim of the toilets, to both sides, and to all other exterior surfaces of the toilets, again allowing for the proper wet dwell time. Wipe all surfaces of the toilets down and leave in a clean and streak-free condition. When cleaning the inside of the toilet bowls, use a Johnny Mop to clean the inside and then replace the Johnny Mop in its carry container. Note, do not use the toilet bowl brush or Johnny Mop on the outside of the toilet bowls or any other surface other than the inside of the toilet bowls. Remember to empty the bathroom waste cans and take all of the same precautions used in emptying the clinical area room waste cans. For example, do not compress the waste. Do not let the full waste bag you have pulled from the can bump up against any part of your body. Finally, wipe the waste cans clean and reline with new, clean liners.
Now let's talk about refilling bathroom dispensers for soap, hand towels, and toilet paper, and then damp mopping the restroom floors. Stop. Remember, you have just cleaned the restroom. Your gloved hands are contaminated with microorganisms of the bathroom. Before you proceed to refill the dispensers and restock towels and linens, you must dispose of your gloves, wash your hands, and put on new clean gloves. Once proper hand washing and regloving has been done, you can proceed. Restock paper towels with the fold properly facing downward so that the towels dispense as they are intended to. Be sure to restock all other dispensers, including those for hand soap, toilet paper, toilet seat covers, and feminine products. As your final step in restroom cleaning, damp mop the restroom floors.
Dust mopping the floors of the clinical support areas and the outpatient treatment areas. Now that you have finished cleaning and restocking the bathroom, the next step is to return to the clinical support area rooms and dust mop the floors. You should always make sure to dust mop before damp mopping because dust mopping first results in a cleaner floor. This excludes situations where there is an obvious blood spill in the room, in which case it is appropriate to damp mop first. If you encounter a blood or bodily fluid spill, use the product SuperSorb in accordance with the product instructions and in accordance with Stroger Hospital's standard operating procedures for cleaning up blood-borne pathogens, which can be found in the Standard Operating Procedure Manual, number 24. When dust mopping, make sure you stay aware of all the foot traffic around you. Work carefully and safely in a clockwise pattern around the room and use an S stroke. Keep the leading edge of the dust mop tool moving forward. Be sure to move any furniture and dust mop underneath. Be careful not to lift or shake the dust mop during or after use. Why? Well, shaking out the dust mop will cause excess dust to become airborne, deteriorating the indoor air quality. Airborne dust is bad for the health of our patients, especially those with respiratory conditions or with weakened immune systems. Also, shaking out the dust mop causes airborne dust to resettle on the surfaces you have just cleaned. Finally, make sure to dust mop thoroughly in corners and along edges. Dust mop the baseboards too. Look behind doors and please do not leave any dust bunnies behind.
Final inspection before damp mopping. Before damp mopping, take a moment to inspect your work in the clinical area and the outpatient treatment rooms. This is the time to inspect curtains and look for stains or portions of the curtain that might need repair. Be sure to check the sharps container, and if it is full, change it out. Check soap dispensers, hand sanitizers, and other dispensers to make sure they are properly refilled. It is also important that you check door hardware and metal kick plates to make sure they have been properly cleaned. If any items in the room need repair, for example, burnt-out lights, be sure to report this to the Stroger Buildings and Grounds Department. Once your final inspection is complete, prepare to damp mop the floor by making sure the wet floor sign is outside of the door. Inspect all corners and baseboards of the room, cleaning as necessary with the mop. Begin damp mopping the floor, working around the room using an S stroke, and again, please pay special attention to corners and baseboards. Make sure to move any furniture and mop underneath. If you find any stains, buildup, or dirt on the floor that you cannot remove by mopping, report this to your supervisor. Before you do, though, make sure you have made every effort to clean it up yourself.
Interacting with patients, guests, and medical staff after completion of your cleaning work. After you have completed your cleaning work, and before leaving the area, ask any patients, guests, or medical staff that are there if there is anything else they need, and help them in any way you can. Remember to distinguish between requests that you are authorized to address yourself versus those that you have to refer to someone else. Generally, if it is a request that involves cleaning, you can respond directly yourself. If it is a request that involves medical attention for a patient, that request needs to be referred to a member of the Stroger medical staff. If it is a request that involves a repair of something broken or not working properly, you will need to report that to the Stroger Buildings and Grounds Department.
Special instructions for cleaning offices, desks, or workstations that may be located in clinical support areas or outpatient treatment rooms. You may find desks, cubicles, private offices, conference rooms, or other office furniture, fixtures, and spaces inside of or adjacent to clinical support areas. When you do, it is your responsibility to provide basic office cleaning services to these areas. Start by performing a visual inspection of the office while emptying trash containers. Plan your work as you perform this initial inspection so that you focus your efforts where cleaning is needed most. When cleaning offices and workstations, before starting, perform hand hygiene and put on new, fresh gloves. Dry dust desktops and other horizontal surfaces using a dust cloth to remove dust. Also, periodically high dust surfaces using an extension tool to remove dust from vents and other high-level surfaces. Use neutral disinfectant cleaner to clean all office and work areas, including desks, tables, file cabinets, chairs, phones, and headsets. If any desks are labeled that they are to be cleaned and papers have been moved off or to the side, then clean the entire desk top surface area, making sure to thoroughly clean phones, headsets, and chairs. If instead papers and files are left out on the desk, do not move or disturb these items. Instead, dust and clean around them, being sure to minimize the extent to which you move or disturb the position of the papers and files. Clean fabric chairs with vacuum or a brush. Clean plastic or vinyl chairs with neutral disinfectant cleaner. Vacuum carpeted areas, paying special attention to vacuum out corners and edges as needed. Dust mop vinyl tile or other hard surface floors, following up with damp mopping as your final step.
Special instructions for cleaning kitchenettes and break rooms. You may find that there is a small kitchenette or break room in any of the clinical support areas or outpatient treatment areas. If so, your duties will include cleaning and disinfecting the kitchenette. As always, begin by performing hand hygiene by washing your hands and putting on fresh, clean gloves. Use neutral disinfectant cleaner to clean all office and work areas, break rooms, and kitchenettes, and always allow the proper 10-minute wet dwell time. Clean and disinfect all drinking fountains, paying special attention to the splash guard, cleaning underneath and the splash guard itself.